Hello students. Today we are going to talk about the pharynx. Now, pharynx it's like a big muscular tube in our throat. It sits behind our nose, mouth, and the larynx and help us with breathing and eating. So think of pharynx as a busy hallway where two important things happen. One is breathing and other is eating. So it is like a meeting point for air and food in our body. The top part of the pharynx, that is the nasopharynx, that is present near the nose, it's all about letting air pass through when we breathe. The bottom part, that is laryngopharynx, it is close to the larynx, is where the food goes when we swallow. So imagine when you eat something, the pharynx helps to guide the food down into your stomach. And at the same time, if you take breath, the upper part of pharynx makes sure the air goes where it need to go. So pharynx, it's a wide muscular tube that is situated behind the nose, the mouth, and the larynx. So nasopharynx, remember it is the upper part of pharynx that is situated behind the nose. So nasopharynx, it is primarily involved in passage of air during breathing. So nasopharynx, it is, remember it is primarily involved in passage of air during breathing, and it is where the opening of the eustachian tube are located. The upper part, remember, transmit only air. The lower part, remember, transmit only food. So upper part transmit only air. The middle part, it transmit both air and the food. The second is the oropharynx, that is the middle part of pharynx that is located behind the mouth. The oropharynx, remember, it serves as passage for both air and food. So it play a role in initial stages of swelling and help you to guide food from mouth to the esophagus. The third portion is the laryngopharynx. The lower part of pharynx is situated below the epiglottis. So that is a flap that prevents food from entering the windpipe. So like the oropharynx, the laryngopharynx is involved in passage of food. So what are the boundaries? So it extends from base of skull. So this is a region that represents the point of attachment of the line of the attachment of the pharynx. So it basically extends from the base of skull to the soft palate. And inferiorly, remember, it continues with the esophagus through the C6 and cricoid cartilage. So pharynx extend till the C6. It is continuous with the esophagus till the cricoid cartilage, the nasopharynx. So anteriorly it communicates with the nasal cavity. Posteriorly there is a body of sphenoid bone. Posteriorly and roof, it is related to body of sphenoid bone, basiociput, and anterior arch of the atlas. And laterally you can see is the auditory tube, above which is the tubal elevation within the tubal tonsil. Now remember, it is lined by the nasopharynx. It's lined by which epithelium? It's the ciliated columnar epithelium. Now So it has a primary function as a passage of air, that is mainly the respiratory function. It contains structure like nasopharyngeal tonsil and nasopharyngeal bursa. So the cavity of pharynx, we know it's divided into nasopharynx, oropharynx and laryngopharynx. Nasopharynx is situated behind the nose. It extends from base of skull to the lower border of the soft palate, and it is lined by ciliated columnar epithelium, and the nerve supply is the pharyngeal branch of pterygopalatine ganglion. The oropharynx, we know it's behind the mouth. It is like meeting point for both the air and the food. This region is the oropharynx. So it extends from the soft palate to upper border of the epiglottis. So anteriorly it communicates with the nasopharynx, and below there is laryngopharynx. So the nerve supply of the oropharynx part is through glossopharyngeal and the vagus nerves. So what are the relationship of the oropharynx? It communicates with the oral cavity anteriorly. Posteriorly, you can see it is related to body of the second, C2 and C3 cervical vertebra. Lateral, there is tonsillar fossa that contains the palatine tonsil. It is lined by, remember, it is lined by stratified squamous non-keratinized epithelium, whereas the laryngopharynx, it is behind the larynx and it helps to swallow food. It extends from the upper border of the epiglottis to the lower extent of the cricoid cartilage, that is near the C6 cervical vertebrae. That is the extent of the laryngopharynx. And the nerve supply, remember, it is by 9th and 10th nerves, that is the glossopharyngeal and the vagus nerve. Anteriorly it communicates with the larynx. Posteriorly it is related to posterior surface of cricoid cartilage and arytenoid cartilage. On lateral side there is piriform fossa on each side of the inlet of the larynx. The lining epithelium, remember, it's the stratified squamous non-keratinized. Now remember, the widest part of the pharynx, it's measure around 3.5 centimeter. The length is 13 centimeter. So it has upper part, middle part and the lower end. The widest part is the upper part, and the main characteristic is that it does not collapse, whereas the middle part, it's the narrower part, narrower as compared to the upper part, whereas the lower end, remember, the lower end, the narrowest part among the lower part is the narrowest part among the gastrointestinal tract except the appendix. So appendix, it is a small tube-like structure that is attached to the large intestine, and it is known for its narrow size. So the narrowest part of the gastrointestinal tract is the lower part of the pharynx. So we discussed that nasopharynx, it is covered by which epithelium? It's the ciliated columnar epithelium. So this type of epithelium has a hair-like structures that are the cilia. So that helps to move mucus, that helps to move the mucus and trap particles, contributing to the respiratory function. So in case of nasopharynx, the nerve supply the mucous membrane, it comes from the pharyngeal branch of the turgopalatine ganglion. Coming to the features, what are the features of the nasopharynx? The first feature is it has a pharyngeal bursa, that is also known as pouch of Luschka. So what is that? It is a small pouch or diverticulum that is present in the mucous membrane of the nasopharynx. So it extends into the this part is the nasopharynx. So it extends into the nasopharyngeal tonsil, that is lymphoid tissue that is present at the back of the nose. So what is the function of this pouch? It serves as mucus diverticulum, meaning it can store or produce mucus. That is, and it is associated with the nasopharyngeal tonsil, that is part of the immune system. Apart from that, you can see is enlarged pharyngeal tonsil. The nasopharyngeal tonsil, when enlarged, it is commonly known as adenoids. So remember, these adenoids, they are common in the children. So enlarged adenoids may contribute to breathing difficulty, especially during sleep. So that is more prevalent in children due to the natural growth and development of the immune system. The third is the pharyngeal hypophysis. The nasopharyngeal tonsil, the third is the pharyngeal hypophysis. The pharyngeal hypophysis refers to the glandular tissue that is present in the nasopharynx, that is similar to the adenophysis. So what is its relation to the Rathke pouch? So remember, it's considered to be a remnant of the Rathke's pouch. So remember, Rathke pouch, it is an embryonic structure that contributes to formation of the pituitary gland. So the nasopharynx, remember, it has a unique features including the pharyngeal bursa, that is a small pouch that extends into the nasopharyngeal tonsil. So when the nasopharyngeal tonsil, that is also known as adenoid, it becomes enlarged, it can cause breathing issues in children. The pharyngeal hypophysis, remember, it's a glandular tissue in the nasopharynx with similarity to the adenophysis that is originating from the Rathke pouch during the embryonic development. Now these are the boundaries. It communicates with the nasal cavity anteriorly. Roof and posterior wall, it is formed by body of sphenoid occiput. Apart from that, there is a nasopharyngeal tonsil which contains lymphoid tissue collection. Now inferiorly, there is nasopharyngeal isthmus. So nasopharynx, it communicates with the oropharynx at specific region, that is known as this one is the pharyngeal isthmus. So this communication point is significant as it marks the transition from the nasopharynx, that is more involved in respiratory function, to the oropharynx, that is involved in both the respiratory as well as the digestive function. Now what are the specific boundaries that define the nasopharyngeal isthmus? Anteriorly, there is soft palate. Posteriorly, there is palatopharyngeal arches. Posteriorly, the posterior pharyngeal wall in which passavant ridge, that is formed by palatopharyngeal muscle, appears during speech. So remember, the lateral boundaries, they are formed by palatopharyngeal arches. So these arches are fold of tissue and they play a role in shaping the oropharynx and separating it from the nasopharynx. Posteriorly, there is a passavant ridge that is formed by palatopharyngeal muscle. So the back boundary is the posterior pharyngeal wall. During activities like swallowing and speaking, a ridge that is known as passavant ridge may appear on the posterior pharyngeal wall. So this ridge, it is formed by the contraction of the palatopharyngeal muscle. That you have to remember for your exam, and it helps to close off the nasopharynx during these activities. In simpler words, the nasopharynx communicate with the oropharynx at the point that is known as pharyngeal isthmus. So this transition area, it is defined by soft palate at front, palatopharyngeal arches on side, and posterior pharyngeal wall with passavant ridge with the certain activities. Other is the orifice of pharyngotympanic tube, that is, remember the eustachian tube. It is located on the lateral wall of the nasopharynx, around 1.25 centimeter behind the inferior nasal concha. So this pharyngotympanic tube, it is important for equalizing the pressure between the middle ear and the external environment. Apart from that, the upper and posterior margin of the orifice of the eustachian tube, they are elevated due to presence of the lymphoid tissue. So these elevated margins, they are known as a tubal elevation, that play a role in maintaining the structure and function of the eustachian tube. A collection of lymphoid tissue within the tubal elevation. So when there is collection of lymphoid tissue within this tubal elevation, it is known as tubal tonsil. So the tubal tonsil, it contributes to the immune system defense against infection in the upper respiratory tract. Apart from that, you can see is the salpingeal fold. So this is a mucous fold that will extend vertically downward on the side wall of the pharynx from the tubal elevation. It contains which muscle? That is, it contains salpopharyngeal muscle. So remember, this muscle will play an important role in movement and function of the pharyngotympanic tube during activities like swallowing, etc. Other is the salpingopalatal fold. So it is another fold extending forward to the soft palate from the tubal elevation, and it contains which muscle? Levator palatini muscle. So its function is to raise the soft palate during activities like swallowing. Apart from that, you can see is the pharyngeal recess. Or it is also known as fossa of Rosenmuller. So it is a depression behind the tubal elevation in the lateral wall of nasopharynx. Now, what are adenoids? Adenoids refer to the enlarged nasopharyngeal tonsil that occurs due to infection. So they are situated in the back of nose and can block the posterior ears. So what are the clinical features of enlarged Uh, the clinical features of the enlarged tonsil you can see is the nasal obstruction. So enlarged adenoids can cause difficulty breathing through the nose. Apart from that, there can be nasal discharge, increased mucus production, and discharge that can occur from the nose. Due to the nasal obstruction, what patient individual do is they tend to breathe through their mouth. So that is why they are frequently mouth breathers. Due to the adenoid enlargement, that will contribute to snoring during the sleep. The children with enlarged adenoids may exhibit tongue protrusion. The voice may sound weak or toneless. The nose may become smaller due to the chronic nasal congestion. Increased blood vessels and irritation causes bleeding to the nose. So the keynotes that you have to remember is the nasopharyngeal tonsil. They are prominent in children up to age of 6 years. They gradually undergo atrophy at puberty and they disappear by age of 20 years. So in simpler words, the enlarged adenoids, they often due to infection can lead to symptoms like difficulty in breathing through nose, nasal discharge, mouth breathing, snoring, tongue protrusion, weak voice and nosebleed. It is common in children, but they tend to shrink as they grow, usually disappearing by the age of 20 years. Important part is the adenoid facies. So adenoid facies refer to the characteristic facial appearance seen in children with enlarged adenoids. So you will see the patient with the children, those who are with adenoid facies, you will see them that they will have obligatory mouth breathers. So that means that they habitually breathe through their mouth. Why? Because due to the nasal obstruction that is caused by, due to the enlarged adenoids. So what would be the characteristic feature of adenoid facies? You can see is patient with have long open mouth face. There will be thin nostrils. The nostrils may be thin and underdeveloped. The upper lip may be short. The upper front teeth may be more noticeable or prominent. Due to the persistent mouth breathing, there may be crowding of the teeth. The upper bony ridge may be narrow. The roof of palate may have a high arch. So a high arch palate that could be a feature of long face syndrome. Important for your entrance exam point of view. So the patient who are generally persistent mouth breathers with adenoid hypertrophy, they can contribute to development of the craniofacial anomalies that can affect the structure and appearance of the face and the jaw. The next part is the oropharynx, that is the middle part of the pharynx is known as oropharynx. It is situated behind the oral cavity. Extend is from level of soft palate to the epiglottis, that is at level of C3, and the extent of whole pharynx is till C6 cervical vertebra. Remember that. The oropharynx extent is till C3 vertebra. What are the boundaries? It is bounded posteriorly by body of axis, second cervical vertebra and the third cervical vertebra. Anteriorly, it communicates with the oral cavity through the oropharyngeal isthmus. Now, what is oropharyngeal isthmus? So the oropharyngeal isthmus, it plays an important role during swallowing. It closes to prevent the regurgitation of food from the pharynx back into the mouth. So the boundaries are: above is the soft palate, below is the dorsal part of the 1/3 of the tongue. On each side there is palatoglossal arch. And it is closed during deagglutination to prevent the regurgitation of food from pharynx to the mouth. So this question was asked in your entrance exam, and this structure was asked in one of the AIMS entrance exam. The answer is oropharyngeal isthmus. Now another feature is presence of palatal tonsil, that they occupy the tonsillar sinuses of the fossa. It is situated between the palatoglossus and the palatopharyngeal arches. So here is this one is the palatine tonsil. It is situated in the lateral wall of the oropharynx. Remember, it is almond shaped, and it has two borders, medial two surfaces, middle, lateral, two borders, anterior, posterior, and two poles, that is upper and the lower pole. So it can be seen through the mouth. On the medial side, it is covered by a type of protective tissue that is known as stratified squamous epithelium, which is continuous with the lining of the mouth, and it contains 12 to 15 crypts. The largest one are known as intertonsillar clefts. On the lateral surface, is covered by sheath of fascia forming the capsule of the tonsil. The capsule, it is an extension of the pharyngeobasilar fascia, and it is loosely attached to the muscular wall of the pharynx but firmly attached to the side of the tongue. So due to this firm attachment, that will help the tonsil in place during swallowing. So this firm attachment helps the tonsil in place during swallowing. The tonsillar artery enters the tonsil just behind the firm attachment. The palatine vein or external palatine vein descends from the palate in the loose areolar tissue on the lateral surface of capsule. It crosses the tonsil before piercing the wall of pharynx. Now the bed of tonsil, it consists of following structures. One is pharyngeobasilar fascia, superior constrictor and palatopharyngeal muscle, buccopharyngeal fascia, styloglossus, and ninth cranial nerve. What are the related structures? You can see is plica triangularis. What is that? It is a triangular vestigial fold of mucous membrane covering the antero-inferior part of the tonsil. Intratonsillar cleft. So the largest crypt of tonsil is known as intratonsillar cleft, and it is present in the upper part. What are the arterial supply of the palatine tonsil? Remember, the main source is the tonsillar branch of facial artery. Additional sources could be ascending palatine branch, of the facial artery, dorsal lingual branch of the lingual artery, ascending pharyngeal branch of the external carotid artery, the greater palatine branch of the maxillary artery. The lymphatic drainage is from the palatine tonsil. The lymphatic from the palatine tonsil, it passes to the jugulo-digastric node. The nerve supply is through glossopharyngeal nerve and the lesser palatine nerve.